The KwaZulu-Natal Health Department says the number of hand, foot and mouth disease cases in the province has surged beyond 110. In fact, the cases were found at 10 primary schools as well as daycare centers. The ages of the children diagnosed range from just 3 to 13. Meanwhile, some parents are now reluctant to send their children to school. For more on this, let's bring in Vee Gani. He's the chairman of the Parents Association of KwaZulu-Natal and joins us now via our video link. Vee, lovely to see you. Welcome to the SABC and thank you very much indeed for your time. Can I just get a sense as a start of who you represent?
Well, it's the Parents Association of KZN. It's a provincial official body here in KZN, representing governing bodies, schools, learners, parents, etc.
All right, fair
enough.
enough.
Thank you, Andrea, for having me on your show.
Thank you. With that context in mind, then I wonder if you're able to speak to us about what the nature of your concerns are. I mean, obviously, there are real worries about children's well-being, given how widespread it seems the disease is becoming.
Yeah, well, look, right now, a couple of hours ago, it was sitting at 117 cases. And of course, on a daily basis, you are getting more and more cases reported. So it is quite concerning. I think the worries parents are having is that they're sending their children to school. And, what is the context? Are their children at risk? How is it going to happen? Do we send our children to school? So that, in essence, is what the concerns are. And I think it's worrisome. The Department of Health is involved. The Department of Education is involved. And especially here with the younger children, it's in schools and daycare centers, which is basically the epicenter of where it's happening.
Has there been engagements between, for example, your organization, the people you represent, and different government officials?
Well, we've been in regular feedback and contact with members of the Department of Education from a provincial level. And obviously they've done some training, they've done some intervention in terms of principals of schools and in the schools itself. And with the Department of Education, in consultation with the Department of Health, they're monitoring the situation on the ground, and they have visited certain schools as well. So we're, obviously in contact, and we are keeping our ear close to the ground to see what developments are happening and how parents themselves can assist in mitigating the risk for their children.
Yeah. I've seen one parent speaking out about just how destabilizing, for lack of a better term, this is for her child. And I imagine that's really top of mind for many parents who are worried. It seems to me, though, that the department's going to need all the help they can get from parents who speak out when they start seeing these kind of symptoms being, exhibited by their own kids.
Well, absolutely. Schools, and I said this in previous interviews, the schools are dealing with 3, 4, 5, 6, 700 children. They are dealing with a number of children. So it's not practically impossible, but it's difficult for them to assess and monitor every child. But here's the thing, parents can do that. Parents are in the position where they can look and monitor their own children, where the children are displaying signs of ill health, where they are sick. Parents themselves can play a large role in curbing this so-called spread of this HMFD.
Right. I can't think of another moment like this in the past, and perhaps you can, Vee, outside of COVID-19. And even then, that was probably a whole lot more extreme than what we're seeing now. But nonetheless, I imagine there are lessons to be learned from that moment about just the good old non-pharmaceutical interventions, is what they call them, in order to ensure that even for children who may have contracted the disease but aren't showing symptoms yet, don't go on to spread it much further than they otherwise would have.
Well, absolutely, but we've had the monkeypox thing. I don't know if you remember that. Some time back. So there has been these kind of scares. The Department of Health is obviously saying, look, there's no need to panic because there's no practical cure for hand, foot and mouth disease. There's no practical cure for it. It just, in about 10 days, it works itself out of the body. But again, the emphasis is that you can only curb this if there's a collective what do you call this now, assistance, and there's collective approach to this particular problem. You can only do that. As you mentioned earlier, parents are scared because every time you send your child to school, it's like there's an outbreak in the school, there's 1 or 2 cases, how is it going to spread? I send my child, now my child's going to be sick. So parents are scared, and this is the reports that I've been speaking to parents where they are very concerned. And, it's very little we can do. I mean, unless the department says, look, if there's an incident in a school, let's shut down the school for a period of a couple of days so that we contain the virus, and in which case we advise parents not to allow their children to mingle or to socialize with any other children. So I don't know how they're going to deal with this, but the cases are rising. It's 117 as of yesterday. By today, it's probably going to be a bit more. So we don't know where this is going to end.
Yeah, outside of everybody playing their part, as you've described, what else, Vee, do you reckon can be done?
I think let's not panic, because I think it creates a bit of a stress on all the parents and all that. I think let's not panic. There is a collective approach to it in terms of the schools. The schools themselves are doing the sanitizing, they're clearing, they're sending notices out to parents on how they should monitor their children, what they should do in the event that the children display any signs of illness. That's about what you can do, because there's no particular cure for this. So we have to play our part in minimizing the risk and minimizing the contagious nature of it. And the only way we can do that is by, as you said earlier, as I've said, parents playing their part, and the department, of course, putting in mechanisms in terms of either shutting down a school, where there's incidents, or minimizing that. The Department of Health coming to and doing more intervention. I think they need to do more intervention. Just visiting these schools is not helping. I think they need to put out public information out there so that everybody gets the same.
All right. Vee Gani, thanks very much indeed for giving us your take. Appreciate the time. Vee Gani is the chairman of the Parents Association of KwaZulu-Natal.